The Eric Adams story is very inspiring. He was a big muscular guy, former captain of the New York City police force, then a New York State senator and very popular president of the Brooklyn borough, and future mayoral candidate of New York City. The thing is, he got very severe diabetes, which included partial blindness, and his recovery was absolutely astounding. But more than that is his influence on the community. So I decided to contact him and see if he would interview with our new and still fairly small YouTube channel. Shout out to Rachel for making it happen. Eric is now one of my great heroes.
Hey, Chris, how are you?
Hey, Eric. I'm good.
I'm
How are you?
sorry.
No problem. I know how packed your schedule must be. Crazy times, COVID and elections and everything else. So we're just so glad to have you.
That is an amazing backdrop.
It's my kitchen. Yeah.
Wow.
Really nice. We have that.
Where do you live, if I may ask?
Silicon Valley, not too far from Google.
Okay.
I'm sandwiched right between Google and Apple and Facebook. So, hey, congratulations on your book. It's fabulous. I don't know where I heard about it. Rachel was asking, but I could tell from the first few pages, it reads like a murder mystery or something. And it does. I mean, well, I guess that fits if you're an ex-policeman.
It actually fits because we're dying because we're slowly being murdered.
I know, it's awful. It's just terrible. So I guess there were several things that were astonishing about the book. The most unsurprising thing is that you got diabetes as a 56-year-old, donut-loving guy. And but then it was kind of astonishing. You went to your doctor, you got the normal prescription for insulin and so on. And somehow you started a Google search on curing diabetes. Is that right? Is that how it happened?
Yes. You know what? It was probably, we were laughing about it, but it was probably because of my law enforcement background that from 22 years of not listening to stories, but doing your own investigation, it's sort of difficult to get rid of those habits. And so the first thing I said after I was told that, this is your new norm, I said, well, you know what? Let me first find out how does one get diabetes, and what are the facts on actually being able to reverse it? Is it out there somewhere? So let's do an investigation, and that's what I did.
So you did an investigation, and somehow you ended up talking to Caldwell Esselstyn, the renowned cardiologist who helped Bill Clinton get over his heart disease. How did you land on him?
Several doctors came up. One was Dr. Greger, Dr. Barnard, and then Dr. Esselstyn. When his name came up and I started reading his information, and of course, being able to treat our former president, who I was in admire of, what he did as a president of the United States, I said, you know what, let me call this guy and see if he would, pick up my call, or if he would return my call. And I was surprised to see how easy it was to actually reach out to him.
He's amazingly accessible. I have friends and neighbors who have all kinds of different diseases and so on. And often I have him call Caldwell Esselstyn, and he graciously talks to them. I don't know if he charges or what, but whatever, he transforms their lives. It's amazing.
He does. And his son is a real good friend. I love his wife. She's a beautiful person. And I have been up in Hudson, New York, and I have spoken at his conference that he does. And so it's just a real friendship has developed.
Yeah, I think that whole family, they're just a national treasure.
Yes.
So you go up to the prevention clinic at Cleveland, or the prevention center at Cleveland Clinic, which he and his wife started, I think. And you sit down with this plate of what you think is going to be bland beans and rice with your girlfriend, Tracy, who was pre-diabetic at the time. What happened next?
Taste the food. And that's why I say in my book, Healthy at Last, the first thing a person should do is go to the recipe section. Because when I tasted the food that they prepared, I was like, wow, this is really good. And it was the beginning of a real journey. And after having a conversation with him and finding out that there was this term in medicine called disease reversal, I was on a mission to try.
Can you excuse me for a minute? I'm sort of dying for a truffle here. Right, right out of your book, Easy Truffles. Mine don't look as pretty as yours. I didn't roll them and everything, and I didn't read the recipe close enough to know that the ground almonds were not supposed to be mixed inside. You're supposed to roll it, but whatever. It's delicious. I'm gonna eat way too many. And Paul McCartney's tacos. Where'd you come up with that recipe?
Reached out. Paul is extremely active around, vegan and plant-based lifestyle, and reached out to him because part of carrying out this function of changing habits is to find what I call credible messengers. We live in a universe where people no longer dig into the crevices of a particular topic. They find credible messengers who they have already vetted and say, am I going to trust them? And Paul McCarthy is a credible messenger. Believe it or not, Fat Joe is a credible messenger. Some of the names on the book that I had to, messages or comments is because I want people, everyday people, to look at the book and see and find a comfort level that this is not someone talking at us, but speaking with us about changing lifestyle.
So I think the first astonishing thing, second astonishing thing, calling Caldwell Esselstyn was one thing, but the level of disease reversal you got for as far advanced as your disease was, did you ever imagine anything like that was possible?
No. I left my internist, who's a wonderful person. I left his office and I was just so despondent. I was just, it was unimaginable to me that, hey, Eric, this is your new norm. Injecting yourself every day, not having, sight, vision loss, looking forward to amputation. It was just, I cannot tell you how I felt when I was going home and sitting at my desk back at my office, wishing there was some way that I could do something differently. And it was just a weight. It was a heavy, heavy weight. And just remember, every day, millions of Americans in one way or another, they're giving that weight on their lives. And it's hard enough going through life than carrying the burden of a chronic disease.
So those millions of people, they probably do what your mindset was in the beginning, which is, it's genetics, it runs in the family, it's the age, it's inevitable, I just have to live with it.
Yes, and those were my thoughts. When he first told me that I was diabetic, my doctor, I basically stated, well, Eric, you knew it was coming. You knew that, your mom was diabetic or is diabetic for 15 years. She was diabetic, 7 years on insulin. My sisters were experiencing major medical issues. My one sister lost a kidney through diabetes. Another one was going through breast cancer. My brothers were all dealing with some form of chronic disease. And so I basically said, well, you knew your time. It was only a matter of time. You were lucky to get to 56 without any major chronic diseases. And so I just almost fell into that rut of adjusting to what being over 50 brings with it.
Do you have any symptoms left?
No, not at all. My blood pressure has normalized. My cholesterol has normalized. The tingling in my hand and feet, my hands and feet, it's gone. The vision problem I was having is gone. I dropped 35 pounds. I just feel amazing in the clarity of mind. And there's just an adjustment in just how I feel every day, getting up with this newfound energy, not lethargic, but just a real different person. I feel like a different human being. It was a rebirth.
And you got to watch Tracy go through the same thing. So when she would come home from work, she would usually be exhausted because she has a big job in the New York public schools. She'd flop out on the couch. But now?
So funny. There's a picture of the two of us in Cuba. and we look at the picture and we laugh. We're like, wow, that was us. And it wasn't as though we were obese. We were just unhealthy. And when we look at the photo, it's just amazing. She's probably at a size that she was when she was 18, 19, and she has that energy of a teenager. She's very vibrant, very energetic. She spends so much time trying out new meals and recipes, and she's just happy to just have life, and she's just enjoying it to her fullest.
Wow, that's so great. So after the success you had, and pretty quick success, you started worrying about your mother, and you mentioned how you approached her and what happened.
And Mom, she told me she wanted to just really stop taking the 9 medications, including insulin and diabetes. Mom was taking medication to bring down her sugar, medication to bring it up, medication to deal with the kidney problems she was having due to the medication she was taking, medication for her heart. And she just wanted to try something different. And she saw me, she was reading some of the stories and hearing some of the things in the interviews. And she said, I want to try. And I told her, I said, Mom, you spent 80 years on the Southern diet, and it means really going all in. And she says, I want to try. And 2 months of going whole food, plant-based, she was cycled off her insulin. And it was an amazing experience.
And that Southern diet, you make some comments about that in the book. I've heard Milton Mills talk about that before. You referenced him in the book too. He's a Seventh-day Adventist and Stanford educated doctor and everything. And he gave a talk on how soul food is not healthy food. It was plantation food, slave food. Can you describe that a little bit?
Yes, and it's just really it's profound how we really evolved, particularly people of color, and the soul food connection is no different than in other ethnic groups. When the colonizers entered parts of the globe, they brought with it the food habits. When you go to Central America and you see people there eating bad food when they have a plethora of healthy food that they grow, but is shipped out. Even Hawaii, how the Hawaiian people were introduced to Spam and made it part of their culture, although they have, just a large amount of fresh fruits and vegetables, but they use Spam as the center of their diet. And you see diabetes, heart disease, high blood pressure. One of the most unhealthy places you can be in is Hawaii, with some of the most healthy food. And that's the same with soul food. We take for granted that this thing called soul food is part of the African-American experience. And I wanted to show in the book that it is not. It is food that was forced on our ancestors, and they consumed it to survive. They knew that this was something that was used as a bridge to get them over the very challenging times of slavery. For us still to be using it and to take the food that was forced on our ancestors and use it as a delicacy, that is probably a Shakespearean tragedy that we must reverse. And the first way of doing so is through education.
I didn't know any of that, and I was born in Alabama, and I was raised in Oakland, and I don't think I met another white boy when I was growing up in Alabama. So I got to eat at various people's houses, and I remember not wanting to eat the collard greens, but I loved the grits and, some of the other things, okra. I even sort of got to like it. Black-eyed peas were okay. The fried chicken, of course, was great. But I didn't really know about, even with that background, I didn't know about pig's feet and all that unhealthy stuff.
And the food you just described, the collard greens, the black-eyed peas, the other foods, they're good food. The foods are amazing. What it is that, one, we take healthy food and we put a lot of salt and sugar and oil. We take healthy food and we make it unhealthy. And then we add the center of our diet is meat, fried meat, fried chicken, fried fish, all of these foods that are just extremely unhealthy. And even when you fry, which is fascinating, particularly using those bad oils, that smoke that you're smelling and inhaling is a carcinogen. It's just as unhealthy. And so it's really about unlearning what we learn so we can really learn to connect what we consume to have a good, healthy life.
So you have a lot of influence because you're the Brooklyn, I'm sorry, what is it called?
President.
Yeah.
That's a county executive in probably your area. New York has 5 counties, and instead of using the term county executive, we call the executive the president of their county.
I see, of the borough. Yeah. So, and you were a state senator for a long time. So you have a lot of influence, and maybe the future mayor of New York. So you decided that's a political career. Were you concerned that if you started talking, that you would become an annoying vegan and that it would hurt your career?
Well, I am known for really leaning into what's right. As a police officer, I started an organization that looked at how could we keep our city safe, but we needed justice at the same time. And so I was a strong advocate for police reform. And it was not always welcomed and considered to be something that was pro-law enforcement. And I think now our present time proved me to be right, that we must have justice and safety together. And that is how I feel about this important initiative. Families must be healthy and safe, particularly our future generations, as we push to get processed meat out of schools here in New York, having a more healthier diet. I just believe it's right. And I think that sometimes, if used true and forthright, that families will start to hear you. And we're seeing that here in New York City. And what was a unpopular conversation now is becoming almost a signature of mine, that this is the person that believes in health and believes that families should not have to benchmark their lives by losing a loved one through a chronic disease.
I admire that so much. And you also reached out to New York City hospitals like Bellevue, where Michelle McMacken runs that clinic on weight loss. I've heard her speak many times, and she seems to have miraculous results with her patients who come in with all kinds of disorders, heart disease and everything else.
Yes, love her. She's just amazing. We partnered with her at Bellevue Hospital to do the first of its kind in New York, if not the country, lifestyle medicine. And the results are remarkable. We have 750 people who signed on the waiting list to get into her program, and over 200 are part of the program. And we're seeing people are cycling off their medicine. They getting amazing results, and we want to continue to watch this program expand and grow. I'm hoping that every hospital in the health and hospital system could also become part of this important initiative so that we can start treating the underlying causes to diseases and not merely treating the symptoms.
So the foreword of your book is written by Kim Williams, who is a renowned cardiologist, past president of the American College of Cardiology. He said something at a conference a couple of months ago that stopped me in my tracks. So he runs Rush University. They have 53 cardiologists there. He runs the cardiology department, but he's got access to the information in the hospital there in Chicago. And they're trying to track how many people get hospitalized for COVID who are on a whole plant food-based diet. And he said in the talk, we haven't found any yet, but we know there must be some. We just want to know the rate. And he kind of put out a call to other doctors about that. Is that, so when you worry about your constituents, diabetes, heart disease, and so on. You guys have been hit really hard with COVID in the past. Have you been thinking about that, or do we know anything more?
Yes, so true. And let's be clear, those over 90% of the people who died from COVID-19 had pre-existing conditions, comorbidities. Over 90% who were hospitalized also had pre-existing conditions. There's a clear correlation between pre-existing conditions and comorbidities and your ability to not be hospitalized or live through a COVID-19. So it's only safe to assume that if you are eating foods that will strengthen your immune system, it gives you an opportunity, number one, not to contract COVID-19, but have a recovery because your immune system is stronger. And I believe the city, state, and country, we missed a golden opportunity to introduce people to a more healthy lifestyle based on what they eat, as well as ensure that we introduce this into our hospitals as we look at potential treatment. And I believe that we're going to have a small number of people who were hospitalized that if they have a plant-based diet.
Yeah, I mean, we talked about masks and washing hands and social distancing, great things, but nobody was talking about diet, and it just seemed like a lost opportunity there.
It was almost excluded from the entire conversation. I did not hear one leader on the national, state, or city level delve into the importance of diets. They ignored it, and we talked about it often, but there was no real push behind the importance of diet.
Why is that?
I think it's a number of things. Number one, they don't believe, and belief is important. Belief is the start of moving in the right direction. Number two, it's unfortunate that our healthcare industry really, I believe, is influenced by the pharmaceutical industry. And we believe in treatment. We believe in prescriptions. We believe in how do you treat those symptoms and not the reasons. Lifestyle is something that is not pushed. And I think that it has an impact on how the experts are talking about how we address COVID-19, pandemics, and other health care chronic diseases.
One thing I was thinking of you the other day when I'm quite fascinated by the Adventist 2 study, 96,000 people that they're studying from North America and Canada, and 30% of them are Black. And I think a lot of the perception is they're mainly from people near Los Angeles, Loma Vista, but 30% are Black, and a lot of them are living in the American South. And yet that population taken as a whole is the longest lived, most disease-free population in the world, no matter where they live, whether it's Japan, Norway, the American South. And it doesn't seem to matter their race or ethnicity. And their code is so simple. It's just one sentence everyone can remember. It's focused on food, which is eat vegetables, fruit, beans, whole grains, and nuts in as close to their natural state as possible. Everybody can understand it. Everybody can remember it. They wrote it in 1863. 20 million of them are the longest lived population in the world. They're hidden in plain sight. And so someone like you goes to the doctor and doesn't hear anything about that.
Right. And that's alarming. And I don't point the finger at the doctors. It is really, I believe, tragic what we're doing to healthcare professionals. Here it is that they want wellness and they would love to see their patients, instead of cycling into the dark hole of more medicine, blindness, amputation, heart removals, and all of the other things that come with chronic diseases, but we're not giving them the instructions to do so. And how tragic it is to leave medical school only to watch patient after patient go through this real decline. They know when the young man comes in and he is dealing with diabetes, they know what's the end of the chapter. And it must do something to them internally. I believe our doctors are going through PTSD. When you see in families just really destroyed year after year after year, hundreds and thousands of patients that you start out with metformin, then you give them insulin, then you're telling them they have to lose their sight, they're going to go on dialysis, they want to lose fingers and toes. You cannot be a human being and not feel the full impact of what medicine is doing to us and what's doing to the medical professionals.
Tell me about it. My son-in-law is a family physician, and he's totally on board with plant-based prevention. And he and his family, 5 kids and so on, they're all being raised that way in remarkable health. And he promotes it to his patients, but it's not mainstream. You know, he says a lot of his patients look at him like, "Are you sure? Because I heard from someone else." So that brings up a question. I don't want to get over the time. I know you have a hard stop, but the question is, why didn't you, when you did your Google search, why didn't you fall for something like the keto diet or something like that? How'd you make that decision?
That's a great question. You know, I'm a big believer that our soul knows the truth. We must take time just to listen. We have so many distractions. There's so much noise. And if we take a moment to meditate and listen, we know truth. And so the keto diet, no carb diet, it all sounded fine. But what resonates more? Eat plants, fruits, vegetables in their closest natural source. That just feels true. That was just it.
Yeah, you know, and your science chapters are so compelling. They're so simple. I know you had some help writing the book. Whoever you got did a really good job. And I've talked to Rachel a few times on the phone, and it sounds like she's a passionate 10-year vegan who probably, did she influence you some?
Yes. She's a plant-based vegan as well.
That's so great. 2 more questions. One is, you have a point of view on exercise, incorporating it into your daily life, not sitting too much. Can you describe that?
And we often make this complicated. I tell people they're Stairmaster. It's just their stairs. You know, use a standing desk. Find creative ways if you can. Do jumping jacks every 15, 20 minutes. You know, stand up from your chair. Walk around the block, walk around your room. Right now in my office, I run up and down the office. You know, find ways to move. Redefine the term exercise. It means simply to move your body. And we often make it more complicated than it is. Take those walks around the block, have standing meetings, just find creative ways to incorporate movement into your life.
That's so great. I really love that. I'm interviewing a gastroenterologist later this afternoon about the microbiome, and he said one of the best things you could do is not sit, keep it moving down there. So final question, you have a 100-point plan, which you're known for, 100 points a day. I'd love to hear about that.
It's just a way to incorporate kindness into your life. You know, I start the day looking to have 100 points. And it's simple things. It could hold the door for someone. That's 1 point. Buying a meal for someone who's in need, maybe 5 points. You know, just giving someone a smile is a point. And at the end of the day, you want 100 points. Whatever number is the gap between the 100 points. If it's 82, that's you're missing 20 points. Put $20 in a jar. At the end of the week, you donate that to a meaningful cause. And so it's just being intentional about giving back, not letting it be an accident or stating that, wow, I didn't do something kind today, but just to build it into your life. I think that we all have to deposit into the social bank of life. So when we need to draw on equity, there's something there. And if you don't deposit anything, then you won't need it when it's time to withdraw for yourself.
I'm telling you, you're an inspiration. It's just, it restores my faith. Not that I was lacking faith in the police or all politicians, but here's a politician and a former policeman who lives their life that way. I just, I salute you. Thanks so much. I know you have another thing to go to. I'll edit this together and send it to Rachel for her to approve.
Thank you very much. Take care.
Thanks. You too. And I suspect you had something to do with that.
I have been vegan for like over 10 years. So
Oh, good for you. Yeah.
I'm happy to have made some helpful intros his way. So